Bipolar disorder is a term that's often misused or inappropriately used or misdiagnosed. So here are the DSM-5 criteria for bipolar disorder. Now, the person has to meet criteria for having a manic episode, and the manic episode could be followed by or preceded by a depressive episode or a hypomanic episode. So what is a manic episode? The person has to have either a persistently elevated or expansive mood, or a persistently irritable mood, or a persistently increased in goal-directed activities or hyperactivity, at least be for a week, or cause hospitalization. Additionally, you have to have at least 3 of the following symptoms if you have an elated mood, or 4 of the following symptoms if you have an irritable mood. And those symptoms are increased sense of self, inflated self-esteem or grandiosity, decreased need for sleep, being more talkative or having pressured speech, having racing thoughts or flight of ideas, getting distracted easily by things in your environment, increase in goal-directed activities. So this is like taking up new projects, taking up new hobbies, and just being all in impulsively. Increase involvement in pleasurable activities. This is like having a lot of sex, doing a lot of drugs, doing things just for pleasure without thinking about the consequences, and this is different than your typical self. Now, it's important because this manic episode must cause impairment in your functioning, so that could be impairment in your social life, your occupational life, your academic life, and it can't be caused by a medical condition or a substance or another psychiatric condition. Bipolar disorder, when you have this manic episode and it's followed by at least a depressive or a hypomanic episode, it cannot be due to schizoaffective disorder, can't be due to schizophrenia, it can't be due to delusional disorder, and it cannot be due to a substance or medical condition. The treatments for bipolar disorder are things such as medications and therapy. Medications such as mood stabilizers like Depakote, antipsychotics like Abilify. Also, in some cases, these newer medications like Latuda and Vraylar may be helpful. Lithium is a medication that is actually on the periodic table, and there's been a lot of evidence about how this may be helpful in preventing or treating manic episodes. Sleep is an issue for people with bipolar disorder, so your doctor may use sleep aids as well. In some cases, electroconvulsive therapy is warranted. Talk therapy, supportive therapy, and group therapies may also be beneficial. Holistic things such as paying attention to your sleep-wake cycle, looking at your nutrition, making sure you're getting good movement are all helpful because they support the mind-body connection. People with bipolar disorder may also have something called anosognosia, where they don't believe that they have a medical condition, so they may stop taking their medications as a result. It's quite common in bipolar disorder. Bipolar disorder is highly heritable, so it runs in families. Let me know what you think.